Here in Toronto, as I'm sure the CMHA staff are all too well aware, we have the access point, which does a reasonable job in connecting people to case management services. And they've done a good job because they've worked collaboratively to reduce wait times in that area. But it still can take 6 months to a year to get connected to a assertive community treatment team. And there are still long waits for early psychosis. But the fact that we're keeping track of wait lists centrally is something we can use with government to say you actually need to find sufficient money to continue to expand services. The current discussion over defunding the police and reducing the reliance on police to respond to people in crisis, that's all about building a much more robust community-based mental health system. So I think what we also need to do is we need to hold the government's feet to the fire on the funding question, or the F word, as I like to call it. I did some work for the Mental Health Commission that led to the Mental Health Commission establishing the target that 9% of health spending should go to mental health and 2% of social spending should go to mental health, and that could be used to develop a community mental health system across the country. Now, that actually would require an annual investment nationally of $3.1 billion. And we're about 16% of the way there, given what the federal government has committed in the Health Accord, which is an annual investment of about $500 million a year. So I think we need to keep pushing and saying, the 9% target was actually the average of what most OECD countries were doing. Britain spends, over 13% on their mental health system. And that doesn't mean that people still aren't complaining about things in the UK, but we could do more and we could do better. And probably the way to really push this agenda item is to talk about it in terms of per capita investment. And I know that sounds, he's talking like an economist and he's only a social worker. But actually, it's a way of making a much more credible ask, because we spend $7,000 a year per capita on healthcare in this country, across the country. And moving to that 9% target would require an additional $85. That would get you there. So $85 per capita per Canadian gets you to $3.1 billion annual investment in mental health services across the country. And then we would see less reliance on the police when people are in crisis. We've had a situation where the Ontario Chiefs of Police and the Canadian Chiefs of Police said in 2011 and 2013, respectively, we're the default crisis mental health service in most communities across the country, across the province. We shouldn't be this. And I agree. But the only way you can fix that is investing in community mental health and addiction programs across the province, across the country, and building on the great work that CMHA Toronto and our CMHA colleagues, particularly in the province of Ontario, do.